Hello, welcome to the news on NTA International, reaching you live from Nigeria's capital city. I am Musbat and Wahab. Let's see the headlines. Federal government inaugurates Secretariat for National Child Rights Act Implementation Committee. Farmers in Imo State get agricultural palliatives to prepare for post-COVID-19. Nigeria Medical Association sets up committee to investigate fracas at Enugu branch executive election. Thanks a lot for staying tuned in. President Muhammadu Buhari has challenged cadets of the Direct Short Service Course 29 of the Nigerian Air Force to be resolute in their commitment towards protecting the territorial integrity of Nigeria. This is contained in his message of a passing out ceremony of the cadets in Kaduna. Abdullahi Muhammad reports.
Orders, precision, discipline and agility, the symptoms of a world-class military training which these young cadets of the Nigerian Air Force underwent in the last 6 months. The arrival of the reviewing officer in a Scottish manner set the ball rolling for the passing out parade. Inspection of the parade by the Chief of Defense Staff in place of Mr. President and a challenge to the officers to go the extra mile in the discharge of their responsibility.
I expect that you will do your best to further enhance Nigerian Air Force efforts towards boosting quality health care for personnel, their dependents, and among residents of Nigerian Air Force host communities, including sustaining medical outreaches for civilians and victims of insurgency and banditry.
The 114 cadets who passed out comprise of professionals in the field of human and animal medicine, nursing as well as logistics. They were subsequently adorned with their ranks and set for a new vista in their lives after taking an oath of allegiance. In Kaduna, Abdullahi Muhammad, NTA News.
Still on security matters, the National Assembly has acknowledged the efforts of the anti-banditry operations by the military in the northwest zone of the country. This is coming on the heels of the oversight visit to the Nigerian Army super camp in Faskari, Katsina State by the Senate Committee on Army. Defense correspondent Ismail Musa reports.
Activities of bandits, kidnappers and cattle rustlers disrupting socio-economic life in the northwest geopolitical zone of the country has forced the military to delve into internal security to stem the tide. Exercise Sahel Sanity, organized by the Nigerian Army, which later transformed to real-time security operation, is one of such that is said to have recorded a lot of success. This has prompted the Senate and House of Representatives committees on Army to embark on fact-finding mission to the Nigerian Army Super Camp 4 Faskari in Katsina State. Chairman of the committees, Senator Muhammad Ali Ndume and Abdulrazak Namdas, were briefed on some of the achievements of the ongoing operation that includes the rescue of 48 kidnapped victims, elimination of 81 and arrest of 78 bandits.
The Army has done a good job.
Armed with first-hand information, the legislators expressed their opinions on the operations to the media.
Have no cause to panic because farming activities is going on. The successes recorded in terms of arrest, recovery, and other activities is very, very commendable. I am very confident that this issue of banditry in the northwest is almost now a history.
For just a month, I think the Nigerian Army has recorded a lot of successes.
The special advisor to the Katsina State Governor on security was on a similar mission to the camp, where he pledged that the state government will continue to support the efforts of the military.
The security operations deserve commendation, deserve applause, And we are mobilizing members of the public to come to the aid of the military by giving them information. They should not shield the criminals.
The lawmakers also commended the high level of ingenuity in the Nigerian Army and promised to improve funding to the military. From the Nigerian Army Super Camp 4 in Faskari, Katsina State, Ismail Musa, NTA News.
And away from security matters, the increasing cases of child abuse and violation in different parts of Nigeria calls for proactive measures to enforce the domestication and implementation of Child Rights Act in all states of the Federation. Minister of Women Affairs, Pauline Talin, laid credence to this at the inauguration of the Secretariat of National Child Rights Act Implementation Committee in Abuja. Ngozi Silva Technical reports.
For most girls, such as Rejoice, who hugs banana to assist her parents and 6 siblings, vulnerability to rape or similar abuses is not an impossibility. The same story goes with Amina and Blessing, among many Nigerian children who engages in one menial job or the other to support the economic condition of their families.
To help my parents so that they can pay my school fees.
Though some are excited in what they do, others feel exploited and their rights being infringed upon. To curb the negative trend of violence and abuses against children, especially the girl child, is why the National Child Rights Act Implementation Committee is re-inaugurated.
The problem of rape and domestic violence is very, very high. And unless we have these laws in place, implementation will be a problem.
So I want to assure that this committee will become very vibrant, particularly with the commissioning of this secretariat.
Other objectives of the NCRIC is to resuscitate similar ailing committees in states and facilitate domestication of the act in the remaining 10 states who are yet to do so. In Abuja, Ngozi Silva Technical, NTA News.
The House of Representatives Committee on Power has issued a 4-month ultimatum to the Transmission Company of Nigeria to complete the abandoned power project in Kano State. Chairman of the committee, Magaji Dao Aliyu, who led other members on an oversight visit to power substations at Walalambe and Remin Zakara, says the committee is committed to fast-track speedy completion of the project. Muhammad Rabiu Ali reports.
The visit by the House of Representatives Committee on Power to Kano State was sequel to the complaint by a member representing Nasarawa Federal Constituency, Nasru Ali Ahmed, over the abandoned power projects in the state. One of such is a 16-year-old 2x40 MVA power substation at Walalambe, which was awarded to address epileptic power supply but did not get desired attention.
This project must be completed by the first day of December 2020. The issue of funding, I think, is not a problem anymore.
We have done the job almost 30%. I'm sure 30%. So before maybe 8 months, we can be able to finish this job, inshallah.
Chairman Dao Aliyu further stressed that Nigeria can only achieve the Siemens agreement if the substations are upgraded to standard. The committee also inspected the 2x150 MVA substation project at Remin Zakara, which have reached appreciable level of completion. The projects, when completed, will address the energy crisis being experienced in the state and improve the socio-economic well-being of Kano and Nigeria at large. Muhammad Rabiu Ali.
The federal government has stressed the need to revive moribund agricultural facilities across the country as a sure way to achieving food security. The Minister of Agriculture and Rural Development, Sabo Nanono, made it known during the distribution of agricultural palliative to farmers in Imo State. Kate Osunwa has details.
The global attack of coronavirus on economies of the world did not spare the Nigerian agricultural sector as farmers were also caught in the web of inactivity created by the COVID-19 lockdown. Determined to alleviate their plight and ensure food security, the federal government is reaching out to farmers in Imo State through this distribution of COVID-19 agricultural palliative. Some of the beneficiaries, including Dr. Vitus Enwerem and Chief Tony Abara, say the scarcity of seedlings and other inputs had been a major setback since the outbreak of COVID-19 and are excited that the federal government has come to their rescue.
It's a good thing that is happening in Imo State today. We need that silos to be functional in Okigwe.
I tag my own back to farm initiative.
The distribution of the COVID-19 agricultural palliative, according to the Minister of Agriculture and Rural Development, Alhaji Muhammad Sabona Nonu, is one of the measures being adopted by the federal government to end the food shortage created by coronavirus.
It is my pleasure to present you the various input for distribution to farmers as part of my minister's measure to mitigate the effect of COVID on food production in the country.
Governor Hope Uzodimma describes the provision of the palliative as a major boost to his efforts at reviving the agricultural sector in the state.
We are looking into the future of mechanized agriculture. This involves why our shared authority established a University of Agriculture and Environmental Sciences.
The agricultural inputs were received by the heads of the farmers' associations to be distributed to members across the 27 local government areas of Imo State. In Owerri, Kate Osunwa, NTA News.
Bringing you latest on COVID-19 as coronavirus cases in the United States of America exceed 5 million as fire kills 11 patients in southern India's COVID-19 facility. Joyce Ometu brings us latest developments in that aspect.
Nigeria has continued to report less than 500 daily coronavirus infections in the past 1 week. Contrary to speculations that Nigeria has started flattening the curve, the Nigeria Center for Disease Control and CDC on Wednesday said the country has not yet attained its peak, as new infections being witnessed currently is a result of decline in the number of samples collected in the country. Latest statistics released by the NCDC reveal that Nigeria has 46,140 cases, 33,044 treated and discharged, while 942 fatalities are recorded. A review of daily reports by the health agency show a total of 12,957 patients were discharged in the outgone week, as against the 3,139 reported in the previous week. Unfortunately, 59 new fatalities were recorded as opposed to the 27 registered in the preceding week, while a cumulative sum of 2,603 cases were recorded. Africa as a whole now records 1,040,712 cases, 23,023 fatalities, and 724,875 recoveries. Worldwide statistics by Worldometer as at 6 p.m. show that the virus has killed 731,148 persons and infected 19,898,776. In other developments, the United States has set a grim record for coronavirus cases, with more than 5 million people infected. And Brazil has recorded more than 100,000 COVID-19 deaths, the world's second highest figure. The virus killed 50,000 people in 3 months, but that number doubled in just 50 days. On a sad note, at least 11 coronavirus patients have been killed by a fire at a southern Indian hotel being used as a COVID-19 facility. And that's it from here. I am Joyce Ometu.
Thanks a lot, Joyce. And now with us in the studio is Dr. Joseph Ugwaja, Chairman Medical Advisory Committee of the Nnamdi Azikiwe University Teaching Hospital, Nnewi, and Chairman Task Force in COVID-19 of the hospital, to speak more on emerging trends in COVID-19 transmission in Nigeria. Thanks a lot for joining us, Dr. Ugwaja.
Thank you.
All right, some people at this point in time think reduction in reported cases in the past 1 week is an indication of a downward trend in transmission. Are we getting out of the wood yet?
Okay, thank you. It might be risky, and it's actually unsafe for us to think along that line. The federal government, the state government, and all the stakeholders must be commended for the efforts we've made so far. It's been tremendous. But like I said, it might be unsafe for us to think like that. What we need to do currently, in my mind, is to sustain what we've been doing. Okay? The PTF has done very well. The federal government has done very well. The NCDC has done very well. The state government have done very well. Other various stakeholders. So what we need to do is to sustain what we are doing. In fact, we need to test more, because it's only if you're testing enough that the trend makes meaning. Assuming you're not testing enough, the trend does not make any meaning. And we know that currently we have challenge in mass testing. And that is why the current efforts, both by the PTF and the Federal Ministry of Health, to establish molecular labs in almost all the tertiary institutions is a commendable effort. And so we must test more. It's only if you've tested enough and the trends are going down, okay, you're comfortable. But if you have challenges in testing, it might not equate to being out of the wood currently. So I want to commend the government for what they've done so far, but we need to do more. The health system needs to be strengthened, especially the tertiary health institutions need to be strengthened, really.
Right,
because there are challenges.
The testing, Dr. Gwaja, as one of what we need to do at this point. Now, with your experience working on COVID-19 in the Southeast, would you say the stakeholders are doing enough to ensure citizens continue to adhere to the safety protocols?
Yeah, in my mind, the stakeholders are doing their bits. It depends on the level of mobilization by people who are involved. Coming from the teaching hospital background, you have external stakeholders, you have internal stakeholders. I think the stakeholders have also done very well. The responsibility of mobilizing the stakeholders is for the key players in the sector. Okay, who are these stakeholders we are talking about? The number one stakeholder is the federal government and the federal institutions supported by the collaborating agencies. They have done very well. The NCDC has also done extremely well. Now, the community stakeholders, the political stakeholders, the social stakeholders, it depends at the level which you mobilize them. We at Anambra State, at the teaching hospital, Nnamdi Azikiwe University Teaching Hospital, have been able to engage stakeholders around the hospital. In fact, as I speak now, a particular group called Anambra Progressives are doing 50-bedded isolation center, world class, for the teaching hospital, because we've been able to speak with them. That group is led by the senator representing our senatorial zone, Senator Dr. Ifeanyi Ubah. That facility will be handed over to the hospital. They have over 10 ventilators, all sorts of equipment in that particular facility. And so it depends on how you mobilize the stakeholders. We are lucky at my own teaching hospital that we have community stakeholders who are interested in what's happening in the hospital. So I will encourage the primary actors. If you're working in a teaching hospital, the hospital management, the board of management, to reach out to the stakeholders. Nigerians want to participate, but you must enlighten them. You must brief them. You must bring them into what is happening. And I can assure you that if that is done, you have to have a whole lot of stakeholder buy-in in what we are doing. So I want to encourage managers of the tertiary health institutions to reach out to the community, the political stakeholders that are willing to help. But if you don't mobilize them, you might not get the necessary support.
What you want. You are very right there.
Thank you very much.
Ugwaja. Now, your primary constituency is the teaching hospital. Now, what have they been doing at the teaching hospital, and what more can they do to help in this fight against COVID-19?
Okay, thank you very much. The tertiary health institutions are key in this fight against the COVID-19 pandemic, because at the level of the tertiary institutions, you have the professionals you need to manage the patients, managing the mobilities that come with COVID-19, the respiratory mobility, all the mobilities that are associated with disease. But what has happened is that most of the tertiaries, or many of the institutions, are not really threatened. That's just the truth of the matter. Let me give you an instance. For instance, in my own hospital, we have an isolation and treatment center that has only 3 beds. It's not a fault of the management. It's the institution as we have seen it. And now, how do you manage the patients? And so we've been asking to be strengthened in order to get a treatment and isolation center. Now, the government has done very well. NCDC currently is also strengthening some of the teaching hospitals. But I think the government needs to look at the tertiary health institutions. Like I informed you, there's an ongoing plan to get molecular laboratory for almost all the tertiary, but it's not enough. In my own mind, all the tertiary institutions must have isolation and treatment center that has adequate capacity, because the personnel is there. That will complement what the state government are doing. Because you have the physicians, you have the infectious disease specialists, you have the anesthetists, you have all you need, all the full complement of the staff you need. So they need to pay more attention at these tertiary institutions, get very corporate leadership principles, and so get an isolation and treatment center that will be able to support what the government is doing. The CDC, like I've said, and the Federal Ministry of Health, even the PTA have done very well. They've kept supporting with materials. Just 2 weeks ago, we received a whole lot of materials from NCDC and the Federal Ministry of Health.
That's good to know, Dr.
The plan must be towards getting all these tertiary health institutions to have isolation and treatment center that has the capacity to admit and manage more patients.
All right, thank you very much, Dr. Joseph Ugboaja, for your perspective.
Thank you very much.
Right, Dr. Joseph Ugboaja, Chairman, Medical Advisory Committee of the Nnamdi Azikiwe University Teaching Hospital, Nnewi, and Chairman Task Force in COVID-19 of the hospital. This is the news on NTA International. We'll take a break. More news shortly.
We have observed the lockdown. We have practiced the measures in order to curb the spread of the virus, but we can do better. The coronavirus spread is increasing daily, and only together can we cut down the numbers and defeat the spread of the virus. Remember, COVID-19 is not a death sentence, and a recovered patient cannot spread the disease. Do not stigmatize. Do not hesitate to report any case, or if you have come in contact with anybody that has been infected with COVID-19. If you have cough and fever, please stay at home and call your state hotline. Find state numbers at www.covid19.ncdc.gov.ng. Remember, it is for your own good and for the good of every Nigerian. Let us do better and defeat the virus. Together, we can do this. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Thanks a lot for staying tuned into the news on NTA International. We're talking politics. The All Progressives Congress, APC, has expressed joy over the massive turnout and support the people of Edo State have extended to the party's National Campaign Council during Saturday's campaign flag-off of the party's governorship candidate, Pastor Osage Izeyamo, and his running mate, Gani Audu, ahead of a September 19 governorship election in the state. Abubakar Usman Akwanga reports.
APC, in a statement by its Deputy National Publicity Secretary, Yekini Nabena, says Edo electorate has sent a clear message on the governor's direction of the state, a progressive one which puts the people's welfare and interest first. The party particularly thanks the Oba of Benin, Oba Ewaye II, for the very warm reception and hospitality His Royal Majesty extended to the party's leaders during the courtesy visit to the palace. The statement also expressed gratitude to President Muhammadu Buhari for endorsing the APC governorship candidate, Pastor Osage Izeyamo, and charged the APC leadership to embark on issue-based campaign and win Edo State governorship election using all legal and constitutional means by avoiding the pitfalls that affected the party's victory in Rivers, Zamfara, and Bayelsa states during and after the 2019 elections. This the APC promised to achieve with a new and positive party disposition under the Governor Mimala Buni-led APC caretaker committee, while promoting Pastor Osage Izeyamu's 6-point agenda of security, infrastructural development, manpower development, public-private partnership, leadership and employment creation. Meanwhile, Director General of the Progressives Governors Forum, Lukman Mohammed, has appealed to the patriotic Nigerians and stakeholders of the All Progressives Congress to support the Mimala Buni-led caretaker committee. In a statement, the Progressive Governors Forum's DG says APC is the only political party with the potential of promoting progressive politics in Nigeria and wants measures that will promote seamless political contest within the party as a way to promote healthy political contest. As the APC moves towards having a national convention to elect new leaders, now is the time to collectively transform the party into a masses-oriented one with expanded membership, developing relationship with organized interest groups. The statement added. Abubakar Usman Akwanga, NTA News.
Away from politics, President Muhammadu Buhari is condoling with Nigerians at home and abroad over the demise of Dr. Dapo Williams, a prominent member of Nigerian UK Diaspora. The president, who sympathized with the family and friends of the deceased, recalls his meeting with Dr. Williams in January this year during a town hall meeting with Nigerian professionals in the United Kingdom. He noted that the deceased was passionate about his country, deeply committed to a Nigeria that attains a position in the Committee of Nations, saying it is sad to lose such a hopeful, ebullient soul so soon. Dr. Williams was a leader and pioneer of a Nigerian think tank group and staunch member of the All Progressives Congress, APC, and Buhari campaign organization in the UK. Meanwhile, Abike Dabiri-Arewa, Chairman CEO, Nigerians in Diaspora Commission, NITCOM, has equally described the death of Dr. Dapo Williams, a UK-based Nigerian, as an irreparable loss to his family, Nigeria, and the UK communities. Dabiri-Arewa stated this in a condolence message issued in Abuja following the death of Dr. Dapo Williams in London and a member of the Nigerian Diaspora COVID-19 Eradication Support Group. In sports, Juventus promotes under-23 coach to main team, as Manzi Marcos reports on Sports Updates.
Juventus goalkeeper Gianluigi Buffon has wished his former Italy teammate and new boss Andrea Pirlo good luck after his promotion as Juventus manager. He signed a 2-year contract and was named the club's under-23 manager on the 30th of July, less than a fortnight ago, replacing Maurizio Sarri, sacked after a round of 16 ouster in the UEFA Champions League. Juventus chief football officer Fabio Paratici revealed the appointment was based on the belief that Pirlo has what it takes to lead from his debut on the bench, an expert and talented squad to pursue success. We also believe he is predestined for greatness. In tennis, 23-time Grand Slam champion Serena Williams has added the French Open to her schedules for this year after last competing in the Fed Cup in February. As part of plans towards winning her 24th major at the August 31 to September 13 US Open, Serena Williams is set to play in the WTA Top Seed Open in Kentucky this week, with staying safe from coronavirus in her mind. I have like 50 masks that I travel with. I am super careful with what I've been doing, and everyone in the Serena bubble is really protected, she said. Defending champion Rafael Nadal and Nick Kyrgios have withdrawn from the US Open due to COVID-19, and so have the women's world number 1 Ashley Barty and the number 2 Simona Halep, amongst others. The Sports Update, Manzi Marcus, NTA News.
And that concludes the news on NTA International at this time. Thanks a lot for your time. Remember to stand with NTA, connect with us and stand against rape and rapists. Good evening.